If you're up in the sandhills of Nebraska or even up on the South Dakota border, on the Kansas border, and you break your arm or you have a heart attack or you have a stroke, you have to depend on somebody or someone to save you. And that's the resource that is GPRMC.
So I fell down in the backyard, and I yelled and yelled and yelled. I couldn't get anybody to hear me at all.
I was at home, and I knew he had been gone too long, so I just started praying for him, and the Lord really did answer our prayers.
Dale's case was very interesting. He is an otherwise healthy man that unfortunately one day developed symptoms that thankfully were recognized as a possible stroke. We already had the stroke program going, and that allowed me to be able to identify those symptoms right away in the emergency department.
It was a right-hand stroke, so the left side was affected, and he still has a little residual in his left hand, but it made us appreciate each other more. You know, just going along day to day, you forget to be thankful for things, and the stroke has definitely made us thankful for each other in our 55 years of marriage.
And there's nothing worse on a parent than to watch your child go through a seizure where they are not breathing, and I mean foaming, all stiff and foaming at the mouth, and there's absolutely nothing you can do to help it. Our family doctor in Gothenburg recommended Dr. Shaw, and so we came here, and from the first time we walked into her office, she listened. She listened to everything that she had gone through and knew what we wanted.
Most important is to listen to the patient. My rule is I don't live in their body, they do. Nowadays, medical science has advanced enough that we can figure out somewhat more suitable medicine which is effective but has a less side effect.
She's a very great doctor, just like my mom was saying. She's just the fact that, like she said, the medication, I've been on 3 medications that I've been on since 7th grade, and no one has lowered any of the dosage. And then now the first time that I saw her, she started lowering the dosage, and so that's all I've ever even wanted from anybody.
My wife and I and my son were eating at the local restaurant, and I was just starting to eat my salad, and my right hand, I just started losing my use of it, and it started getting heavy, and it just went down, down, down. And my son, being an EMT, he was able to identify the characteristics, and so he said, "Let's go. You're having a stroke." It was just like a massive medical assault on me. Everybody dropped everything, and even the first person I talked to, it was just like it was an emergency, and they just attacked, and they just started taking good care of me, and I was just awed by all the attention and everything that they were doing.
The importance of Great Plains to this community is probably one of those areas of discussion that centers on, oh my God, what would we do if we didn't have it? I think it's that important.
To be able to have a facility so close in proximity to respond to the needs of whatever the case may be, it's a comfortable feeling. I mean, you're glad, because if it's not you, what about your family?
It's more of not just as a sleep doctor, but also act like a psychologist and, and as a friend to really help them, understand their problem, and also to know how they should play a big part in treating themselves.
Any parent would that loves their child wants the best for them and wants the best care, and I'm not going to settle for less. So having the hospital here with, such good doctors, I'm a lot happier.
Having a facility like Great Plains Regional Medical Center in a community like North Platte is wonderful and is a great benefit for the people that live here.
I don't think we could have ever gotten better care than we received here. And the care and concern from nurses, all the staff was just very special.
I just see deep commitment, deep dedication to serving others. We live it every single day, whether it's our docs, whether it's our staff, whether it's the volunteers. We just see a huge, deep commitment to the healthcare needs of West Central Nebraskans.